All right, everybody, I think we can begin. So first of all, once again, my name is Matt Melishevsky. I'm with AVTECH, and thank you to all of you for joining today's webinar, Take the Challenge Out of Patient Engagement. Today, we're going to be focusing on our solution called Patient Reactivation in the program we have developed around it. So as we kind of begin, please feel free to put any sort of questions in the chat box as we move forward with today's presentation. I want to make this as interactive as possible. So please put them in there. We'll try to address them during the call, or we'll have a Q&A at the end. And so thanks for everybody for joining, and we can begin. All right, so before we go into the presenters and wanted to share what we're actually going to be focusing on, today's agenda, we're going to talk a little bit about who AVTECH is and why we're here. Also talk a little bit about the trends that we're seeing in the marketplace and why we came up with a solution around patient reactivation. And then lastly, we're going to focus on the solution that we have developed around how we can help organizations bring patients back in for those elective procedures. All right, and outside of myself, we have a couple of presenters. Mike, if you don't mind introducing yourself, that'd be great.
Yes, thanks, Matt. Mike Piedig, I'm the VP of Healthcare Experience here at AVTECH. We've got a healthcare dedicated vertical that is primarily focused on the provider and payer market, and look forward to talking about some of the key trends today that are impacting providers, as well as what's inside the minds of patients as you think about how to bring patients back into the health system. Steve?
Yeah, hello everyone. My name is Steve Smith. I'm a Principal Solutions Architect, both on the healthcare team and the retail team, using some Microsoft tools called Customer Experience or Patient Experience. And I'll be doing some live demonstrations today of the patient reactivation solution.
Excellent. Lastly, once again, I am Matt Melishevsky. I lead our Microsoft Healthcare practice, and just going to talk a little bit about AVTECH and who we are and what we do to begin. All right, so just want to give everybody a little bit of brief understanding if you're not familiar with who AVTECH is. We are a Minnesota-based national known company, and today we're going to be focusing on a little bit about our capabilities, specifically around 3 different areas that we focus on. So if we can go to the next slide, Mike. You know, really our North Star that we focus on is around consumer experience. So when we talk about this, we're thinking about how our consumers, and consumers can be customers, they can be patients, can be members of an insurance organization, how they are digitally engaged with the clients that we work with. So if it's through voice, if it's through a portal, or if it's through any sort of kind of digital engagement, how are those customers being treated by our clients? So our North Star, what we really are passionate about, is making sure we provide exceptional consumer experiences for those end clients. And we do that through a couple of different consulting practices that we have. First and foremost is around what we call customer experience strategy. And what that is really understanding how patients, customers, consumers engage with our clients through the whole landscape of their kind of cradle to grave consumer experience. So understanding how they first get engaged, how they potentially might purchase a product through you, all the way to how they might need customer service on the backside, or how that repeat performance is. So we have a team of consultants who specifically focus on what that experience is, and we provide recommendations for how they need to be engaged, right? So how we provide roadmaps, how do you need to improve those, and really focusing on really those drivers around that CSAT score and how those clients are treated, because in the end, if you treat them well, they're going to come back to you. And we do this through a breadth of technology capabilities. First of all, we have voice, right? So we are Genesis's largest partner worldwide, and Genesis is a contact center solution. So when you think about telephony, so when you call if you're calling somebody and you pick up the phone and you hear who they are, you want to make sure that you know all the information about them. So we focus on that contact-centered capabilities. We also do this in the Microsoft technology stack on the backside, and that includes everything from CRM solutions, customer engagements with the Dynamics platform. We also develop a myriad of solutions around business productivity and app development. So if it's through a chatbot that goes to a website, if it's through a data and AI project, so you need to understand kind of all the data and information about a specific customer, We develop these solutions from contact centers to web platforms to any sort of business productivity tool that may be out there. We develop those solutions to help provide a better digital engagement for our customers, or our clients' customers. Go to the next slide. Excellent, thank you. So one of the ways that we do this is obviously, as I said, through Microsoft technologies, and that's going to be the focus of today's presentation as we move forward with this. So our solution is built upon the Microsoft tech stack. And as you can see, this is something we call our trophy slide, is what I like to call it. In the Microsoft field, we are very highly renowned. Two areas of practice that we like to focus on is, first of all, is what we call our data and AI practice. And that's going to be a focus when we talk a little bit about customer insights. We are an AI Inner Circle, is 0.1% of all partners have this accreditation. And then in the Dynamics part of the platform, which we're going to be talking about in the Business Application Suite, we're also an Inner Circle partner. So extremely knowledgeable and understanding of the Microsoft platform. And as we go through the patient reactivation program solution, you'll be seeing how we leverage these solutions to provide technology that really fits the needs of what our clients are looking for in this challenging time. I'm going to turn it over to Mike to kind of talk a little bit about the trends and sentiments and why we developed this solution.
Thank you, Matt. Today I'll be highlighting key healthcare trends to consider when implementing a patient engagement strategy, as well as incorporating results from a recent AVTEC's patient sentiment survey. And to do this, I'm going to tell the story of two individuals. The first will be Mary. Mary's an employee, a member of the executive team at a health system, and through Paul. Paul will be playing the role of a patient today. Let's meet Mary. Mary's been tasked by her CEO to get patients back into the health system. As we all know, going back to earlier this spring, once the health systems were forced to shut down elective procedures, there were significant financial impacts, and many hospitals and health systems were losing millions a week or even a day. There have been a number of traditional approaches that Mary has tried to get those patients back into the health system, including TV and radio and billboards, but they just haven't been successful. Even with the reopening, we were all more optimistic that patients would come back, but it's still been slow. Utilization is not at the pre-COVID levels, and therefore health systems are looking for any unique and creative solutions to accelerate that recovery. What Mary knows, based on the research she's done, is that there are solutions out there that would solve for 5 key challenges. Number one is the ability to unify her data. She recognizes that she's got data in the EHR system as well as other systems, and it's difficult for her to have a golden record or a complete 360-degree view of her patient. The second criteria is it needs to be personalized. The TV ads and radios and billboards are not personalized. It's not something that really connects with the patients. And so her new approach has to be personalized in order to drive increased engagement. 3, it needs to be proactive. She can't wait for the patient to determine they need care. She needs to communicate important information ahead of time. 4, she wants to embrace the rise in digital channels, which we'll explore a little bit more later. And 5, it needs to be something that she can measure, that allows her to go back to her leadership team as a hero and demonstrate how her investments are driving additional revenue back to the organization. I think this slide does a great job of articulating the different, or highlighting the different phases that providers and other healthcare organizations are going through post-pandemic. So we all started with this initial respond or reactionary phase, which was in essence a fire drill. We needed to put in some quick fixes. We didn't have a lot of time to step back and think strategically. Our immediate focus was on the safety of our employees and our patients. And now we've moved into the recovery. The recovery is where we're stabilizing, where we're restarting those activities, we're reopening, we're bringing folks back that have been furloughed. And this is where we start to plan for what will be our long-term future. As one health system executive said to me, if you're not already in the recovery phase, you are too late and you are behind. So Mary's goal is about helping her organization make sure that they're fully into the recovery phase and what lessons they can learn. And the quicker she's able to get patients back into the health system to maximize revenue, to maximize resources, it will help accelerate that transition to the long-term renewal phase. Mary also knows that consumer expectations are evolving and growing. 42% have said that their personal experience directly influenced their choice of a healthcare provider. While 42% may not seem like a large number, it's interesting to note that it's twice what we see across other industries, including retail, hospitality, and travel, industries that have been well known for focusing on the importance of the consumer experience. We talked a little bit about different channels, which are both an opportunity and a challenge, because 65% of patients have said they're frustrated by the inconsistent experiences that they get across those channels. You can't just offer a channel unless you can connect them and create a seamless experience. And finally, consumers say that a generic and impersonal experience is what leads to a bad brand experience. And so for Mary, what she's thinking about is she knows that customers and consumers and patients want to have a relationship with her health system. She knows they're expecting today that if we are collecting their personal data, then we should be using that personal data and have that information when we engage them. We should know them, we should value them, we should be able to help them. And so as we look at those expectations, they're no doubt, they're high and they're increasing, and it's safe to say that the power is officially shifting to the consumer. And we'll wrap with the last trend that Mary's really thinking about, and that is the explosion of digital channels. At one point, we thought that we would see a decline in voice and IVR, while these other channels like chatbots, social media, SMS, and mobile apps would increase. But it turns out we are not seeing that decrease. It is an and, not an or. But it's not the old-fashioned IVR that you're used to. Think of it as self-service. They're smart IVRs. They allow me to pay my bills through the IVR, or I can schedule an appointment or reschedule an appointment. And so it's key that when you're thinking about all of the different channels, that you are meeting your patients where they're at today and engaging them via the channel that's of most interest. And if you're not, I can tell you your competitors are. Now let's meet Paul, the patient. Paul was originally scheduled to get his knee replaced back in June. Unfortunately, due to COVID, that appointment was canceled. And now, even though he's received a letter from his health system recommending that he reschedule, that letter did not address many of his concerns. He's still unclear about what the next steps are. He's anxious about, and quite frankly, nervous about catching COVID and what risks what risks he'll have to consider by going back into the health system. And he's still dealing with that knee pain. At AVTECH, we were very interested to better understand what Paul and the other patients across healthcare were thinking, and what would be some of the steps that providers could do to accelerate the recovery. So we conducted our own survey of over 1,000 patients nationwide. Here's a few of our findings. 85% of patients agree with the statement, overall, I trust my healthcare providers. Not only do they trust us, but they're looking to the providers to be that source of truth. There's a gap that exists in the real-time nature of the communication that patients are looking for. And they don't want to rely on Facebook or YouTube or CNN. They're looking for their providers to lead the way. And when doing so, we also need to think about it from the patient perspective. And our communication needs to be different. It needs to be real and authentic and truthful and show empathy. We also ask the patients, what is most important? And number one is safety. This list, this chart shows the top 15 items that patients identified. Number one and number two disinfecting surfaces between patient visits, and wearing masks. Number 3, PPE for staff. And 4, 5, 6, all are focused on safety, keeping the patients safe when they come visit the facilities. After safety, next most important, communication. And I've highlighted it down below here, sending communication to patients describing the safety procedures. 31% said that they will not go back to a provider without receiving communication that describes the safety procedures that are in place. And if you compare the extremely important as well as the very important, 72% have put this high on their list. Additional points to communicate include COVID testing policies and procedures, parking and transportation, rules around allowing visitors, and any other safety or process related requirements will be important to your patients. And finally, Paul wants easy access to his health system and his providers. Along with Paul, 91% said we're looking for more information on what services have reopened and what are the rescheduling procedures. 89% said that they wanted the ability to schedule their appointment online. No need to call in and talk to a live agent. And once that appointment is scheduled, over 90% said that they would like an email reminder for that upcoming appointment, or an 89% said a text reminder would be a great next step. When you pull all of this together and you think about the key trends that's on Mary's mind, as well as what's in the mind of our patients, it allowed Mary to create her ideal solution. A solution that would unify the data, pulling it from her EHR and other repositories. That it would prioritize the segments. It would give her the ability to initially focus on those appointments that were canceled or needed to be rescheduled, but then dive deeper into it and prioritize it based on resource availability, revenue, profitability, patient acuity, or even use it for other use cases, including the launching a new service line. She could fill data gaps because she knows today that her database does not have complete digital records for contact information for her patients. In order to do so, she needs emails, phone numbers, social media accounts. Her team is small. She needs to leverage the power of artificial intelligence and machine learning to help reason over the data and identify key trends and patterns, while incorporating the best CX and PX practices, the customer experience, the patient experience. This is the current state and future state journey maps. It's the voice of the patient work. And turning all of that into a messaging that resonates with patients. It lets the patients know that we know them, that it's personalized and it's informative and it's addressing their concerns. That it can integrate with her MarTech platform or offer a MarTech platform if she doesn't have one today. We talked about the importance of making it easy to engage with her organization. And then she needs to see it all in a very nice dashboard. She can report on it. She can share the results with her leadership team and track her progress and her success. The good news is this solution does exist. It's data-driven marketing, and for that, I'll turn it over to Steve.
This solution that we have for patient reactivation isn't a product. It's a packaged approach, leveraging the Microsoft platform. We've successfully used this same platform and approach across multiple industries. So you can imagine, retail, quick serve restaurants, business to business environments. So we've used the same approach across multiple industries. And the last kind of point is you might already have many of these tools licensed from Microsoft from this platform. We can help you check to make sure that you have the platform licenses or tools, but more than likely you already have many of these tools. So I want to start with the patient experience, right? We talked about Paul the patient. One of the key fundamentals at AVTECH is the patient experience, and it's these three words: know me, help me, and value me. So knowing me is understanding my relationship with you, conditions and my needs. Helping me is educating me on what I need to do to get and stay healthy, and then to value me, show me when and where to get the help that I need. So let's go back to this Mary, right? So Mary is tasked by her CEO to get her patients back into the health system and increase revenue. And she's looking for solutions that are in these 5 areas. We're actually going to touch on each of the 5 areas. And then after I'm done showing you kind of the slides, I'm actually going to show you live what the patient reactivation solution looks like to do all 5 of those things. So unifying, personalized, proactive, digital channels, and measurable. So what does unified look like? So unified means this is Paul the patient, and on the left side, this is all of the information coming from your HIS system, your Cerner, your Epic, your scheduling system, etc. This is everything that you know about the patient. In the middle is all of the activities that patient has interacted with your organization. So procedures, encounters, medications, care plans, imaging, all of that in this timeline, so that you have a 360-degree view of your patient. So that's what unified looks like. What does personalized look like? Personalized means taking all of that transactional data that you have about the patient, about their encounters and their schedule, and adding demographic, behavioral, and proprietary information. We get this from third-party sources. So we have a library of over 30 different third-party sources. Give us social determinants of health and other financial, behavioral information about the individual patient. And yes, we do this very securely. We do this for healthcare customers. We do this for government customers. We can sanitize the data before we send it to the providers, so that when the providers send the data back, they don't really know any of the patient identifiable information, no PHI, right? We can fully enrich that profile to give you everything that you want to know about the patient, right? All of the determinants of health, right? Smoking, diabetes, access to healthy food, access to education, what their education level is, how many children they have, all of that information that allows you to know your patient so that you can help them and value them. So this is what Know Me, Value Me, Help Me looks like in an email message to Paul. We hope this email finds you healthy, right? It talks about all of the things that Mike mentioned, right? How we disinfect surfaces, right? We wanted to remind you that your total knee replacement procedure needs to be rescheduled, right? And give them one click. Click here to schedule online, right? That takes them right to an online form, or they can click here, go right to the IVR system to talk to somebody to schedule. So this is what Know Me, Value Me, Help Me looks like in an email message. But this same email message can also be a text message. If you text them, they can opt in and receive all of those updates that Mike talked about, right? I think he said that, 70 or 80% of the patients would actually like email reminders, right? Prior to your scheduled appointment, this is what you need to do, right? These are your preparation requirements. This is what you can expect when you come in tomorrow. Here's where to park. Here's, what you need to bring with you. All of those things we can actually incorporate into the customer journey, into the communications. So what does proactive look like, right? So Mary the marketer, she was charged with, I need to bring patients back into the organization, right? So patients with unscheduled ortho procedures. So we've gone into the system and said, if the scheduled date for that procedure is greater than today, and these are all the procedure codes. So these are the ICD-10 procedure codes for for knee x-ray, surgical manipulation of the knee, admission to orthopedic, surgical manipulation, whatever those codes are, we can create a segment of those patients so that you can take that segment and go market to them, right? You can actually go into your MarTech platform and send the text message, send the email message, even do social media posts, right? So this is what digital channels look like. And this is a screenshot taken right out of Dynamics Marketing. But whatever marketing platform you have, these are the typical kinds of steps that you would take during a marketing initiative. So I've taken that ortho patients, that proactive list, loaded it in, said I want to send an email message to it. When the email message is opened, do they go to the scheduling page or do they connect with a scheduling agent through our IVR system? And then if they don't open the email, I can take alternate steps here, right? If they don't open the email after 7 days, I want to send a second email. This is the kind of content that I want to put into that second email. And you can structure these emails and these text messages and these social media posts with very rich content, right? Very rich graphical content with buttons in it and, you know, all of the information that they need. And you can make the email actually come from the health system. And then finally, what does measurable look like? So you're sending emails, you're sending social media posts. This is a dashboard that as soon as you launch your campaign, you can actually start monitoring how many people, how many messages did we send, how many were opened, how many were clicked on, how many actually filled out a form, how many scheduled, and how many actually completed their procedures. This is an interactive dashboard where you're actually looking at how much marketing cost you're spending to send those emails or to do the social media posts, right? To do the Facebook and the Google ads and things like that. And then these are all the campaigns you're running. So we have ortho hip, ortho knee, ortho shoulder, and what the effectiveness of those campaigns are. So on the social side, how many posts did you make? How many responses? What's the social sentiment of those responses? From a messaging standpoint, number of emails versus text messages, right? Some of the patients did not opt into the text, so we just went traditional email, and then just how many were sent, open, and clicked. This is a very interactive dashboard that allows you to kind of examine your campaigns and how effective they are at generating, you know, revenue for the organization. How many people scheduled their appointment, met the schedule, completed the procedure, right? So you can track all of that in a single place. So this is your feedback loop. This is taking the patient, knowing them, it's putting them in a segment that you're going to market, you know, send some communications to them. You're sending the communications, and then they're coming in to have procedures done. But how effective is the messaging and persuading them to come in, right? Where's the comfort level? So I'm going to switch over. I'm going to do a live demonstration. Mike, can you just confirm real quick that you can actually see the screen?
I can. Good to go. I see data source.
Yep. So these are all of your EHR data sources coming in, right? So we've mapped in your care plans, your observations, conditions, immunizations, basically everything about the patient. And we've also brought in a third-party enrichment source. So that enrichment contains email address, it contains cell phone number, social media accounts, those kinds of things. Then what we do is, there's Paul the patient, right? Here's all of the data about Paul that we have, right? Both fully enriched and from our EHR system. Here's your activities timeline. Here's all the activities that we have interacted with Paul. This is all of the times that he's been to the hospital, communicated with the hospital, you know, over the entire duration of since we've known him. Then what we did was we went in and created the patients with unscheduled procedures. So when I open that panel up, you'll see greater than today with these codes. I want to create a segment, and I want to call that segment patients with unscheduled ortho procedures. I can create one patients with ortho conditions that I might use for social media. I can say even some of the third-party enriched data that we're bringing in may be about someone who's never visited a health system before, right? Prospective patients, patients with known conditions, diabetes, CHF, right? Any kind of known condition that we can get, we can load those in and create additional segments to go market to them, right? Facebook campaigns, Google advertisement, search optimization campaigns, whatever your segments are that you want to campaign against, you can create here. Then what you do is you take those segments, you export it to your marketing platform, right? So I'm going to go into marketing. I'm going to create my rich message. This is the rich message that I've created, you know, that I'm going to send via email. And this name, hello Paul, this Paul actually comes from your EHR system, from the segment. So I've created this rich message. Then what I'm going to do is I'm actually going to create the journey. So I'm going to say ortho patients with that segment, all those patients in that segment with canceled procedures. Take that marketing message, send it via email. You can have an identical campaign to this and say send via SMS text message, right? Then your trigger, did they opt into the text message? Did they open the email? Did they click on the schedule, right? And then you can take all kinds of additional actions here to track the fact that they scheduled online. And then your EHR system, you're going to see the events or the activities of them actually being scheduled in the EHR, the actual procedure being performed and completed, right? That ties into that final dashboard. So this is the live dashboard where I'm looking at that ortho knee campaign. How effective is that campaign? How many people have actually come in and, you know, interacted with the social posts, right? Or, you know, how many emails were sent, how many were opened by month, how many procedures were completed, etc. So I can drill into my campaign, check the effectiveness of the campaign. Campaigns that aren't working, we can go back and look at that campaign and say, we can do a better job messaging, right? Let's kill this campaign because this campaign's not being very effective, right? Maybe Facebook ads aren't being effective at, you know, colonoscopies or at cancer screening, but maybe some other campaigns are. So it depends on, you know, your marketing budget, what kind of spread you want to put out on the digital channels. So when Mike talked about omni-channel, talking about all the web and social, all the different messaging platforms. So with that, I'm going to go back to the presentation. I want to just kind of close out. So Mary was tasked by her CEO to get patients back into the health system. So she unified all her data. She created very personalized messages. She took a very proactive approach to saying, here's the different segments of ortho patients or colonoscopies or mammograms or whatever the different groupings of patients that they needed to come back into the health system, right? Then ran them through the digital channel and made sure that everything was measurable. So you can measure digital channels, unlike TV, radio, billboards, and print. Digital channels allow you to see the fact that they opened the email, that they clicked on the link, that they actually scheduled the appointment, and that they actually came in for the procedure. So some real results from one of our healthcare clients is a 3 to 6 times improvement over traditional marketing approaches. 30 to 40% improvement in digital reach. That means email addresses and phone numbers coming from the enrichment sources. meaning that you can improve your digital reach and a very quick return on investment. So if you calculate the value of a patient's return to the health system, and you say a patient's return for, let's say, a knee or hip replacement, and it's worth X number of dollars, you can actually go through and say, you know, we sent 50 of these out, 24 of them re-engaged, 24 at that dollar value, means this is how much revenue we've generated for the organization compared to how much money we spent on the actual marketing campaign itself. So increased retention of current patients that were, you know, scheduled and we needed to reschedule, improved brand image, really gives you a strengthened competitive advantage and improves health outcomes, because Paul's still in pain, right? Paul's nervous about coming back. He's been waiting on the health system to contact him to make him feel comfortable, make it easy for him to come in and have his knee replaced. And then from Paul's perspective, right, patient satisfied, right? He's very comfortable. His trust is improved, right? He's hearing this message not from social media platforms. He's hearing it directly from his health provider, right? Great brand image is improved. Means he's going to tell his friends and his family that, you know, he's had a great interaction with his health system, made it super easy for him to come back in, make him feel comfortable. His loyalty's improved, right? He's going to keep going back to the health system for his healthcare needs. And overall, his health is improved, right? So Paul's journey to recovery, Paul is happy and healthy again.
All right, well, I think, yeah, thanks, Steve. Thanks, Mike, for kind of running through this. I think we got a couple of questions for everybody. So we'll hopefully have a couple more come through the chat window. Mike, the first question is for you, I feel like. Outside of patient reactivation, are there any other target use cases to use for this sort of solution?
Yeah, thanks, Matt. The beauty of this solution is that you're really creating a foundation that you can then leverage for a number of other use cases. You may start with the patient reactivation, but once you then have your data that's centralized and you've got it connected to, you know, the third-party data sources, you've got that unified view that Steve talked about. That allows you to massage it and use it for other use cases, including managing chronic conditions. Maybe you're opening a new clinic and want to target those patients, new patients who have moved into the area, the Silver Tsunami, PEDS programs, unlimited number of use cases once you've got this in place.
All right, excellent, thank you. Steve, this one's for you. You mentioned ROI. This is ROI 3x6. How do you measure the real results?
Yeah, so like I explained earlier, for every campaign that you're running, you have a value to the organization of that patient reactivation, that type of patient reactivation. So if it's procedures or tests, each one of them, you have what the value to the health system is per patient for reactivation. And knowing what that value is, then back to that kind of dashboard that I showed, you know what your cost is for how much money you spent in marketing to send those emails, those text messages, to do your Google and Facebook ads, and you're comparing that to how many people actually scheduled an appointment, came in and completed the procedure or the test, and then you just calculate the return on investment. It's, well, how much money did I spend on it? How much money did we earn in revenue for bringing those patients in? And then that way you see, because not all the patients will engage, but as I said earlier, from our other experience, it's 3 to 6 times what traditional marketing campaigns have been for one of our healthcare solution customers.
Steve, another question for you. It's what type of integration with my EHR is needed for this solution?
Yeah, so you know, the big EHR vendors, you know, Epic and Cerner and so forth, even the scheduling applications themselves, pretty easy to connect into those data sources. You know, obviously the HL7 and the FHIR standards are out there that allow us to very quickly gain access to your EHR system, and usually very minimal involvement from your IT staff, right? It's a connection that's there. We drop the platform in place and just connect up to the EHR vendor via the industry standard connector. So very little IT involvement. It's usually very quick to connect up to your EHR systems and your scheduling systems.
Okay, Mike, we have one last question for you. It's about how do organizations usually begin with this sort of program? How do we get started?
Yeah, assuming they start with patient reactivation, there's still some decisions that need to be made. It may decide that you don't want to target all 50,000 appointments that were canceled during COVID. And so what our customers have done is decided how do they prioritize those appointments? And that can be done, really, it's not something that we do on our own, but we do as a partnership with our clients. We'll look at the resource capability, either the staffing or it might be the OR suites or other resources in a hospital or health system. Look at the acuity of the patient. That may decide to put those patients to the top. Obviously, revenue and profitability is key, or a number of other factors that go into that decision. But that is not something, you know, that is necessarily clear, but it's part of our engagement is working with the health system to determine where do we want to start. And then from there, you can continue to add additional patients and service lines to the program.
All right, well, that was the last question that we had. I'm going to leave it open for a couple of minutes just to see if there's any additional follow-up questions. While we wait, just wanted to make sure that everybody is aware that this webinar is recorded and we will be sending out a link which gives you access to it for posterity's sake, as well as some blog information that we have around healthcare strategies and what we've seen in the marketplace done by Mike here. So if you would like to have a further discussion around patient reactivation, my email is down at the bottom. It will be emailed to you as well because it's a very long email. So certainly don't hesitate to reach out. Love to talk to you a little bit about the challenges that you're facing or any of the other technologies we talked about, including just pure patient experience, strategy work, contact center work that we do, or anything really in the Microsoft landscape. We love to really strategize with our customers, understand the challenges that they have, and understand how we can help kind of, you know, overcome hurdles and challenges that you have in your organization. But, you know, that's what we do and love the chance to talk to you a little bit more about it. Also, if you're interested in any more of our webinars or information we have, please click on the AVTECH Thoughts link down at the bottom. A plethora of other webinars as well as blogs and information we do as an organization. So it looks like we don't have any further questions. So I'm going to take a moment to thank both Mike and Steve for their outstanding job in doing today's webinar. Hopefully everybody enjoyed it, got a little bit of information, and thanks for attending today's patient reactivation webinar. Everybody have a great day. Thank you.